Living with neck pain can keep you from enjoying your everyday activities, but the experts at Florida Pain Relief Group want to help. Dr. Gary joins us again today to discuss how they can help you with your neck pain. Welcome back, Doctor. We appreciate your time.
My pleasure.
Neck pain. I mean, I'm not going to lie, that's kind of what I fall under. And you say that it's also one of the most common things that you do see in your practice.
Sure. So low back pain is usually the most common one. Second to that tends to be neck pain. And if you think about it, most of your rotation, most of your wear and tear and so forth is in your lower back. But the second most common one is in your neck. We're always turning our heads, we're twisting, we're looking down, looking up. Our heads are actually kind of heavy. And so a lot of that twisting motion and so forth can cause problems with your neck. That can cause inflammation in your neck. That can lead to headaches. So there's all kinds of different reasons why you can have that neck pain.
I was going to say, we kind of touched on back pain already, but it's interesting. Back pain, neck pain, how much does posture play a role in these kind of problems?
Posture plays a very big role. In fact, a lot of times what happens is, and this can also happen with doctors, if you're looking down a lot, well, your body wasn't meant for that. So if you have to hold your head by looking down so much, it can cause a lot of stiffness. It can weaken your ligaments. You can get a herniated disc back there. That herniated disc can actually cause inflammation of your nerves. It can be very excruciating.
And you know, you hear the term like crink in your neck, and I kind of want to do like as I'm saying this, like the popping motion as I try to sit straight up for you. What is the crink in the neck? Is that kind of what we're talking about here?
That's part of it. So when people talk about the crink in your neck, is actually you have 7 bones in your neck area called cervical vertebrae. They're stacked on top of each other. In between them are these little discs that act like shock absorbers. And on the side of them are these joints called facet joints. And what I tell my patients is those joints are real joints, just like knee joints and elbow joints. And they can get inflammation. Yeah. So they go, Doc, well, why do you have joints there? And I said, well, you know, if we recall the movie The Exorcist, I said, well, if we didn't have facet joints, we can do like The Exorcist. We can turn your head 360. But the joints stop you from doing that. So, but those joints, a lot of the wear and tear, you get inflammation. Inflammation can actually cause problems and irritation in those nerves. You can get what's called occipital neuralgia, which is the nerves that go from your neck up to the back of your head, and that can cause some serious debilitation as well.
Well, I'm assuming, you know, people always talk about, you know, when it affects your regular life, that's the time to give you a call. So what do you do when a patient comes in? It's like, oh, I've got the crink in my neck. Well,
the first thing I'm going to do is this normal? You know, it might be, if it's the usual crink that's only for a few hours, maybe a day or two, it goes away. If it stays there a lot longer, and you know it, you know, so you know if this is just something that's not normal for me, you should come and see a physician. See a physician like us, see your primary care doctor, see a physician, because it's not normal, and we have to evaluate, make sure, and see what's going on there. Maybe something simple, or maybe something a little more involved.
Well, I would say, what are some of the procedures, really quick, just to kind of help, that you can use to help patients get out of this pain?
Procedures are dependent on the cause. So, for example, one of the common things we see is a herniated disc. A herniated disc is basically your shock absorber in between those bones. It bulges out, causes impingement of the nerves. You get what's called a pinched nerve.
Yeah.
It's really inflammation of those nerves. We can put a little medication there into that inflammation, reduce the inflammation, get that pain to go away, send you back to physical therapy, get you back in.
And once again, I'm noticing no surgery.
Surgery is the last thing you want to do.
Okay.
A lot of times you need it, and if you need it, you need it. But what we find is usually surgery is because it's gone on way too long without being treated, or it's some sort of a trauma or something like that happens. But there's a lot of things we can do to avoid that operation. In fact, most surgeons, if you go see them immediately, they'll usually send you to see us first.
Oh, okay.
Because they want to make sure that we can treat you first before they actually do an operation. And if we cannot help you, we will refer you to a surgeon that can help you.
Wow. Well, again, I like how you treat every patient differently. You find the background, you find the problem, and they will do what they can to help you. So for more information on how Florida Pain Relief Group can help you with your neck pain, you can call 844-KICK-PAIN or just log on to floridapainreliefgroup.com.